Hello everyone, and today's note we are talking about something called herniation. So what is brain herniation? Brain herniation is there is a substance of the brain tissue that herniate from the one hemisphere to another hemisphere. We have different forms of herniation. First, we're going to talk about the subfalcine herniation, which occurs under the phalanx cerebri, and it doesn't cause anything. Actually, they have no clinical picture. Okay? The second thing we're going to talk is about the tentorial herniation or transtentorial herniation. It may be central in the substance of pituitary gland and hypothalamus, and also it may be lateral. So what's the difference between them? First, we will begin with the lateral transtonsillar herniation. Here there is something from the lateral brain herniate to the other side and compressing the brainstem. So first thing we are going to talk, it's a decreased level of consciousness. That's something for sure will be affected. The second thing is it also causes third cranial nerve compression. So when the cerebrocrinial nerve become compressed, it affects the pupil and it become unilateral dilated fixed pupil. It become dilated and not responsive to light. So we call it fixed. Doesn't cause meiosis when the light falls on it. It also causes ipsilateral weakness, and we call this ipsilateral weakness a false localizing site because it gave you a hint that the patient had a stroke or something like that, but notice it is not due to stroke. It's something mass or something that edema shifting the hemisphere to another side. Okay, so it's called ipsilateral weakness due to compression on the descending tracts, and it calls a false localizing site. So that's about the lateral transtentorial herniation. So what's about the central transtentorial herniation? The pituitary gland for sure is affected. So there will be endocrinal abnormalities, there will be diabetes insipidus, and also there will be decreased level of consciousness, and finally the pupil will be affected. First, the pupil will be affected in meiosis, then it become fixed dilated pupil. The last thing I'm going to talk about is the tonsillar herniation, and here tonsillar herniation is considered a very severe case because it is responsible for the Cushing triad, and the Cushing triad is something for sure you should have known from your study. Cushing triad, it reflects three things. First is Chinese stroke respiration, and here the respiratory pattern of breathing is prolonged inspiration and expiration, and we also have apnea. Then after that we are going to have a decreased level of consciousness. Actually, it's become the most affected thing in transtonsillar herniation. Also, the last thing I'm going to talk, Cushing triad is also have bradycardia and hypotension. So that's for lecture of today. Thank you.